Hello, everyone. My name's Hank Setala,
And I'm Dr. Adriana K, also known as Dr. K
and
from
this is another
Integrative Management.
this is another episode of Holistic Highlights. Thank you, everyone, for joining us. One quick note, if you missed last week's episode, we talked all about the energy of food. And so if you want to go back and check that out, we have great recommendations and things about how to, enhance your body by what you're eating. And today, kind of going along in tandem with that, we're talking about supplements. And that is a whole nother, we probably could have 5 episodes on
Oh,
supplements. There's so
yeah.
much information out there about supplements. But where did you want to start our magical conversation today?
Magical. I love that word.
Yeah, everything's
Everything's
magic.
magic.
Right.
It is magic. Everything's magic. So I want to break things down into basics because supplements is a very broad topic, and I do very individualized um, kind of evaluation, so to speak, with the clients that come to me because everybody has a different condition, and what may work for one person is not something that another person needs. But to give you very basic tips so that you can gain a little bit of basic understanding and go out and do what you need to do in that respect. So, first off, piggybacking off of our last episode, supplements are still synthetic. So, the body, really prefers food and it recognizes food better than something made. So we have supplements, we have, all those vitamins and those sorts of things that are synthetically made, meaning in a lab. And, sometimes you obviously don't want a whole lot of preservatives and those sorts of things. But they are still kind of man-made. So you want something, the food is really what nourishes you, but not always optimal. So I always try to veer on the aspect of food, but then supplements are synthetically made. And then you have your medications that are really synthetically made and the body really doesn't really like and recognize, but sometimes necessary. So when dealing with supplements, I always recommend, or homeopathics, I always recommend getting a liquid form or a powder that you mix with water and drink. And why is that? Because liquids have a higher surface area, meaning when you take a pill of any sort, your medication or a vitamin, you take it through your mouth, it goes to your stomach, and then your stomach acid has to break that capsule down, and that takes time. It has to break that capsule down and then extract those nutrients. With that said, if you've ever thrown up, you know that that stuff is coming out is really acidic. So you can imagine that what if that hurts your throat and you have that churning in your stomach, the acidity is designed to break down your food to a complete liquid. But with that said, it kills off a lot of stuff. So I tell people, you're sometimes, and if your stomach's not working right, then you're really kind of in havoc. You're not absorbing 100% of what you're getting, especially if your stomach's not working right, and especially if you don't have enough stomach acid. So sometimes people say, "Well, I take vitamins," but it's based on your stomach, it's based on your acid level, and those are separate conversations. But really, with if you can get something that's in a powder form that you just mix, and I have various companies that I use for that, or a liquid that's already a liquid, your stomach goes, oh, don't have to digest it. It's a liquid. It goes right on through your stomach into your small intestine and gets absorbed where it needs to get absorbed. So that's my first takeaway. Wherever you can get something in a liquid, liposomal, meaning under your tongue, or a powder that you mix and you drink, you're going to have better absorption. If you're obviously if your stomach's not working, then you still get a little bit less than usual. But
And that brings up
that's the
a
thing.
thing too, like with certain things like probiotics specifically, it's not just how you're taking it, it's also when, like probiotics, it's really good to get taken on an empty stomach, if I remember
Correct.
correctly, because you get it
Correct.
into the gut more quickly, and other things maybe are better at different times.
Correct. Oh, and with that thought, I will tell you there's certain things you won't be able to get in powder form, because like probiotics typically there are some companies that have it in a powder form, but most of the time those things have to be in a pill form. So I'm not saying this across the board for everything. There's
Oh,
certain things you
there's a way. I've never swallowed a pill in my life, and so when I get it, I get these little tubes of like 25 billion count, and I'll mix it in with like cold water or juice
Yeah,
to
and the other thing you can do if you're brave enough get things that are in capsules. You open the capsule and dump it in your smoothie or water or whatever you need, whatever you're taking it with. So that's the other way to get around it. If you are brave enough to just chug it down or put it in a smoothie, then you can just open the capsule and dump the contents. And that way that's kind of powder, your powder form, and it kind of goes through a little more easily. But things like probiotics, yeah, you definitely want to take on a half hour before eating, 20 minutes to a half hour before eating, so that gets in your system and gets absorbed first. So that's the basics. I thought we'd talk about, start by talking about some drugs that gobble up your vitamins, because vitamins and minerals work synergistically. They need each other. And a lot of us are really mineral deficient, a lot of times vitamin deficient. And when you're taking medications, it's actually depleting a lot of your vitamins. So it's kind of fascinating. These medications gobble up the vitamins, and then you don't have the biochemical reaction that you need versus the vitamins that you need. So when you get depleted, all sorts of things start happening, and we won't get into that. So I have a list of some basics that might be helpful. Do you have any 2 cents that you want to contribute, Hank,
No
before?
2 cents
No?
quite yet,
Okay.
but just a reminder for everybody joining us, or even if it's on a replay, if you have questions, make sure you put them in the comments. We can always speak to them in a future episode, but we love the
Yes.
interaction. So if you have something specific on your mind, feel free to post that in comments and we'll be happy to speak to it.
Right. And if I don't have the answer, I will research it and find it for you. So some basic medications. I'm not going to go over all of them, but some of the biggies like antacids. A lot of people take antacids for stomach upset, indigestion. So you're talking your Pepcid, Zantac, Prevacid, Prilosec, those sorts of things. What do these deplete? These deplete vitamin B12. It depletes folic acid. It depletes vitamin D. It depletes calcium, iron, zinc. Those are biggies. So just be in mind that when you're taking an acid after a meal because your stomach's upset, or you're taking it on a daily basis, which I know people that take these medications on a daily basis, it's creating a bit of a problem. So vitamin B is super important.
Now, when people do have an upset stomach, is there something they could take for something like that that wouldn't have this other consequence? Because I think I remember there was home remedies years ago. There was like a big push for this one book, and they had like very particular things saying that sometimes when it's a stomach issue like that, it's opposite of what you think it might be. And
Stomach is a whole conversation
okay,
separately, really, but you could do peppermint. That will calm your stomach if it's upset, helping with digestion. Taking a digestive enzyme will help a lot with, because a lot of times people not, or they don't have enough stomach acid even to digest the food. So sometimes you have to take a digestive enzyme, especially if you're eating a lot of meat, that's hard to digest. Pretty much with anything, if people are having a difficult time digesting food, a digestive enzyme will do a lot of times do the trick. Um, Ginger is also very helpful for digestion. Um, what else can I think of? There's some other things that are just not coming to mind right now,
it's all
but
right.
there's a
That's enough
couple.
for people to get started.
But digestive enzymes do solve a lot of issues, believe it or not, so that things don't, it helps your stomach liquefy the food easier so that you don't have chunk particulates. So that's one of the things that I use for sure. Antibiotics. If anybody's taking antibiotics, that is depleting your beneficial intestinal bacteria. So antibiotics really screw up. Excessive antibiotic and long-term antibiotic use really screws up the stomach. And we've heard of the whole gut dysbiosis, leaky gut syndrome. This is one of the things that really causes it. So if you're getting concurrent infections, um, then we have to look at why you're getting the concurrent infection and handle it completely so you don't keep getting it, and then repair your stomach, because the antibiotics they're wreaking havoc in your system. So
And I think that's probably a good topic for next week because we could dive into that too, like the whole leaky gut syndrome, candida.
yeah.
That could be a separate topic.
Oh.
So we got our topic for next week, unless someone gives us another one.
Yeah, thanks for extracting that. I was wondering what we were going to talk about next week. I'm like, oh, I got to think of a
Well, now you
topic.
know. Now we can plan
Now
ahead.
I know, leaky gut. We'll go over the whole intestinal tract so people understand that. Antidepressants. Gosh, I can have a whole topic on antidepressants. There's natural things we can use. There's so much more we can do. You can put that on the parking lot too, Hank. Talk
Oh,
about
I'll start a
antidepressants.
list. We might have to go to
um,
2 days a week if we keep getting more and more topics.
right? Yeah, and there's a lot with antidepressants and what they do. And I'll very quick note, we'll discuss this more. I have researched almost every single one, and almost every single one has a black box warning. And we'll discuss what a black box warning is. That means it's dangerous. So we won't get on that. Okay, antidepressants like Elavil, your Xanax, all these other things in the antidepressant family deplete uh, vitamin B and vitamin B. Let's see, vitamin B2 and CoQ10. So B vitamins, which is actually a little contradictory because vitamin B, which I'll go over, the B complex, vitamin B's all work together. Uh, but vitamin B is really actually really important for the brain and for so many other functions. So that kind of contradicts itself, really. You'll get a little slower in the head if you're using an antidepressant sometime because you're losing the vitamin B's that are important. And CoQ10 will go over in the next thing that I'll talk about. Diabetic medications. There's a whole slew of those guys: glucophage, micronase, metformin. There's a whole group of anti-diabetic medications. So if you're diabetic and you're on a diabetic medication, you're depleting CoQ10 and you're depleting glucophage, particularly depletes vitamin B12. Again, contradictory. A lot of diabetics have something called diabetic neuropathy, meaning you have tingling or burning in your feet or you can't feel. That's a deficiency of vitamin B12. So a lot of times supplementing that fixes the problem, and folate, methylfolate. So that's kind of interesting. Always was interesting to me there too.
My dad actually
Anti-inflammatories.
has issues with that. I'm wondering if that B12 might be. I don't know if he's ever taken a supplement for anything, but that would be a good one. But perhaps start with to see if he gets a little bit of relief with that. How long does it take to see, like, any result with that, or do you have to be on it for a long time to
Probably
kind of
about a month to 2 months.
month to 2 months?
Yep.
I think he
And
would be
alpha
willing to
lipoic acid.
give it
There's
a
a
shot
lot.
for a couple months. I will do that. I'll be a guinea pig, and I'll see if I can get my dad to check that out, and I'll report back.
There's a whole protocol I use with diabetics. So alpha lipoic acid is really important there too, along with the B12. And I'll discuss how to take the B12 because that's really important too. Chromium is really important for diabetics. So it can be a slew of things, but we have to get to the cause a lot of times because sometimes it's a heavy metal that affects the nerves too. So it's a little bit of an investigative process,
Yeah.
but
I just had a thought about that, but I'll talk offline about it. I just, when you said heavy metal, I'm like, oh, I wonder if something else might be going on then. But anyhow,
it can be a combination of things, but those are some basics: alpha lipoic acid, vitamin B12 in the methylcobalamin form, um, and let's see, chromium, and there's a few that I use, so I can tell you that offline. Um, so let's see, yeah, anti-inflammatories. So that's your aspirin, your Advil, Aleve, Dolobid, Indocin, Lodine, Motrin, Nalfon, Naproxen, Relafin, Voltaren. There's a whole slew of them. Those deplete folic acid, and things like cortisone, dexamethasone, hydrocortisone, prednisone. A lot of people are on prednisone. These deplete vitamin C, vitamin D, folic acid, calcium, magnesium, potassium, selenium, and zinc. So I hope you guys are taking notes because this is
oh, fortunately, you can go back and rewatch the video if you haven't been taking notes. It's out there, so you can go back and
yeah.
rewatch it as many times as you need to.
So aspirin, I'll repeat that. Aspirin specifically depletes vitamin C, folic acid, iron, and potassium. When we get into Advil, Aleve, Feldine, Indocin, Lodine, Motrin, and Advil are really kind of the same. But Nalfon, Naproxen, Relafin, Voltaren, these deplete folic acid. Betamethasone, which these are actually steroidal anti-inflammatories, but betamethasone, cortisone, dexamethasone, hydrocortisone, methylprednol. I can never pronounce this. See, I went to medical school, but I still can't pronounce half these things.
I was wondering, where did they come up with
Methylprednisolone.
these names? They could obviously make it smaller. Like they come out these huge things that no one can ever remember or say.
I
Anyhow,
don't know
I
why they do
digress.
that. I guess
Uh,
it's just fun. Then people can basically prednisone. and people know what prednisone is. These deplete vitamin C, vitamin D, folic acid, calcium, magnesium, potassium, selenium, and zinc. So those are biggies. Blood pressure medications. A lot of people on blood pressure medications. So these can deplete vitamin B6, CoQ10. CoQ10 is a big one, and we'll discuss that. So a lot of the B vitamins they will deplete. They will deplete vitamin C, magnesium, which is a big one, calcium, potassium, zinc. Those are the biggies that high blood pressure medications will pull. You'll just get depleted. Cholesterol medications. A lot of folks on cholesterol medications. We'll talk on that. Biggest thing that cholesterol medications deplete is CoQ10. And I have had many patients that have come in and said, I feel weak in my legs, I get cramping in my legs. The research has shown that this depletes something called HMG coreductase, which is basically CoQ10. It depletes this biochemical process. And this is why you get all these cramping in the muscles. And so what the doctor will do is switch you, if you come in complaining of that, they'll just switch you to a different one. They'll switch you from like simvastatin to something else. And then people still get the symptoms. Across the board, it doesn't matter. All cholesterol medications deplete CoQ10. So you really have to supplement with CoQ10. And they used to do this. They used to have a patent on this when they included the CoQ10 in the medication, and now they're no longer doing this. So it's kind of bizarre. So any of those cholesterol medications really, and high blood pressure medications will deplete CoQ10. The other thing cholesterol medications deplete is vitamin A, beta carotene, vitamin B12, vitamin D, vitamin E, vitamin K, folic acid, and iron. So those are two blood pressure medications, and cholesterol medications are, I find a lot of people are they're just given that because the funny thing happens is as primary care doctors, we're given the AMA comes out with standards, and anybody that's diabetic needs to be put on a cholesterol medication. Anybody that's got this needs to be put on a high blood pressure medication. And we just give it without really questioning it because these are the guidelines that supposedly they've researched and came out with now. But it's doing some damage. So yeah, I don't get into all that. If you're on hormone replacement therapy, because a lot of ladies are on hormone replacement therapy as they get older. So if they give you like Prempro or Premarin or Estratab, depletes vitamin B2, vitamin B6, vitamin B12, folic acid, vitamin C, magnesium, and zinc. So there's a lot, yeah.
And some
Quite
people are on like
ones.
10 medications. Like I remember being with someone when the doctor had come in and they were going over the discharge papers. They said it was okay for me to stay. And as they're reading it through everything, it was like 15 different things that they were taking.
So you can
And
only
if each,
imagine how depleted they are.
like 15 different things, and they all might be affecting vitamins or minerals in a different way. That's kind of mind blowing.
Yep. Oh yeah, and you need these vitamins and minerals so that when the body's deficient of these, I'm going to start going over some, that's my next on the list here is a whole list of really the vitamin C's and the big ones to tell you what's going to happen, what could happen if you're deficient. So these are just larger categories that a lot of people are on that I chose. Oral contraceptives, any oral contraceptive you're on will deplete vitamin B2, vitamin B6, vitamin B12, folic acid, vitamin C, magnesium, and zinc. Zinc is a really important one right now too, so we'll discuss that. And the last one, some folks are on tranquilizers just to take the edge off. Everybody's stressed. But those deplete vitamin B12, CoQ10. So really important. Those are some broad categories of a lot of people are on some of those medications. So I thought I'd just pick some larger categories. And then of course there's a million medications out there and trying to research each and every one. My goal really is to work to get folks off of medications that are not absolutely necessary. And there's a lot that can be done with diabetes through diet, through berberine is actually a really great supplement to take for diabetes. And it has surpassed metformin, which is a diabetic medication. It has surpassed it in studies. But guys, I don't want you, if you're diabetic, just don't take it upon yourself. Please give me a call because you have to have specific dosages and it can have a little bit of a side effect if we don't dose it correctly. So
Yeah.
don't
And I just
scroll
added your
quick
website in the upper
for me.
left-hand corner of the screen. You'll see Dr. K's website, and on there you can, and I'll post a link to in a moment, but you can connect with her. There's a way you can schedule a phone consult and things like that. So if you do want a place to start and at least have a conversation about what your options are, that is a great way to get started. So I'll
Yeah.
leave that up here for a moment while I go get the link to post in comments.
Yeah. Yeah, but berbeриne's great. I have gotten a handful of folks off of diabetic medications, and they're on berberine and doing great. Uh, Again, the goal is to even get you off of berberine too, but that's diet. Not everybody can go to that extreme, because it is an extreme. If you really, really, really want to get healthy, sometimes you really have to give up some of those things that you love and create new habits. So we meet everybody where they are, but losing weight's huge with diabetes. The blood sugars come down and the HbA1c comes down drastically just by changing a little bit of the diet and exercise. So 17,000 studies on that. So it's amazing. But so that I always tell people it's not just one thing, because sometimes people come in with, I have this and this. I'm like, okay, well, we need to look at various angles. It's never just one thing. Everything's tied together, everything's talking to each other. And, I get lots of information through my biofeedback device that tells me what's going on. So it's not just, sometimes it's very easy and it's just one little simple thing. But majority of the time we have to look at, if you're getting recurrent urinary tract infections, let's handle those so you don't keep getting them. But why? Is it because you have taken antibiotics for a long period of time and now your stomach's a mess? And now your stomach's a mess, we got to heal that. um, it's a little bit of a tiered effect. So I'm saying that with a grain of salt. The other thing I will tell you with ibuprofen, Advil, Motrin, those are called NSAIDs, non-steroidal anti-inflammatories. They really, really damage the gut, and it gets really challenging to repair the gut after that. So just beware. There's other things that I can get for you that are actually natural forms of ibuprofen to help with pain and inflammation. There's a lot out there. So let's try to figure out why you need that and get you off of it.
Yeah. And
So
on a side note, a lot of pharmaceuticals are based off of things that are natural, like wintergreen has aspirin in it, birch has aspirin in it, mandrake root has aspirin in it. And then there's one, copali, I always mispronounce it, but it's like an oil from South America that is one of the most anti-inflammatory substances on the planet. And they basically take the oil and they say out of these 350 components of rose, which one chemical is good for the depression, and then they
right.
extract or they synthesize that, but you're not getting the other 349 things that put it into balance that gave it a synergistic effect. And then you get all these symptoms, like for depression medication, one of the symptoms is suicide. Doesn't it seem counterproductive?
Oh yeah. Yeah,
uh,
that's the interesting piece about, we'll talk about antidepressants too. It fascinated me that every single one had a side effect of suicidal tendencies. So
yeah.
how does that even make sense? So it's, yeah, we have to work on using maybe some energetic technology and some figuring out why. And you could be depressed and low because of a lack of a mineral. It could be a simple fix like that. So there's a lot, it's a big picture. So we're just giving you basics. Um, cool. So, and I tell people, if you absolutely have to take something for pain, aspirin is probably better than ibuprofen. It doesn't damage the gut quite as much. So, but if you're already, it's also going to thin your blood. So if you're a bleeder, then that's something you have to keep in mind. And with ibuprofen, I will also mention this really quickly. Not only does it damage your gut lining, it predisposes you to a cardiovascular risk. You're at much higher risk for a heart attack if you are, and heart problems and circulatory problems if you are on a long-term use of ibuprofen, like daily, or even, multiple times during the week. So let's like work on getting you off of that. If that There's so many things out there. I'm sure Hank can even suggest some oils or things for pain that there's so much out there. But let's get to the root cause and find out what that is while we give you some oils and things to help you, because that's ibuprofen's a biggie. not a huge fan, but I get it. People are in discomfort, and who, yeah, we don't want to live like that. So completely get it.
Right. Brian
Um,
has a really good analogy for things too. Sometimes, like when you need something in the moment, he uses the analogy like if your house is on fire, you'll get a blanket, put water on it, put it around yourself, get out. You don't always wear the blanket then. And sometimes so we're using medications, perhaps like always having something instead of dealing with the issue, which is the house is on fire, like deal with it and then don't need the blanket anymore
that's
versus
exactly
always
what I
having the
deal
blanket.
with
Right.
because I have had, with the energy technology I use, I have had results, pain just resolved just by a few sessions of doing some other things that I do. When you get to the root cause, it's amazing how things dislodge and pain improves.
And if you go to our YouTube channel, or it's also on Facebook, but you're going to have to scroll back further. If you go to the Holistic Health and Healing YouTube channel, there was one episode. In fact, I'll go grab the link and I'll post it, where she hooks me up virtually to the biofeedback machine. And it was staggering how accurate the thing was. Like things that I did in jobs that I worked at in high school where I had like exposure to a lot of pesticides and fertilizers and things, like the machine was indicating that. And so it's an amazing piece of technology that can take a lot of the guesswork out. So it's not just a matter of having a conversation. There's like technology that can show you like this is what's going on based on the energy that their body's putting out. So it's
Yeah.
quite amazing. I'll grab that link while you continue talking
Yeah,
with.
and the machine does not only that. I mean, if somebody's having depression, if somebody's having anxiety, if somebody's having pain, I use that. I use energetic technology, and literally, I have a feel good program. You literally just sit there, and it's an electroceutical, so it will just send things to
I
you.
just like that name, electroceutical.
Yep,
That is
electroceutical.
awesome.
It
I love
sends
that
just
name.
frequencies. So like I discussed probably in that video, we're made up of electrons, protons, neutrons, all those, the positive and negative charges. We're just a bag of organs with positive, negative charges. So as you manipulate the positive and negative charges, hence electroceutical, we are electromagnetic beings. As you kind of send those frequencies at certain wavelengths to a person, they start to improve. So there's lots of programs I can use just for anxiety and pain and all. I mean, you name it, it does it. It's an incredible device. So it's, basic premise of biofeedback of just slowing somebody down and calming them down. And it just, yeah, it's great. Great stuff.
All right. And in case
So
some people on my profile might not get the comment, the name of it is, I'm going to rename this to quantum biofeedback, but the name of the episode is Stepping into Wholeness, and it was aired on April 17th. So if
oh,
you're looking,
great.
I did post a link, but I know that I shared this to some groups. So if you're watching this from one of the places I shared it, I'll throw it up on the screen as a banner real quick. But if you just go to YouTube and search for that title, you will find it too.
Awesome. Thanks.
Hmm.
So I think next, the best thing to discuss is I put not a whole, but a list of, I think, big vitamins that are kind of important. Um, and if you, let's say, if you, what they help you with, and then what happens if you have a deficiency. So there's a ton out there, obviously, but and I can't get into all of them because it would take me forever. But vitamin C, which is a big one that we need, it's important. It protects against coronary arteries, heart problems. It protects against cancer. It protects against joint disease, cataracts. It protects obviously against colds, bone matrix, your skin, your teeth. It's antiviral, and it has some detoxing properties. So what happens when you're deficient? You can't heal wounds. So if you're having difficulty healing wounds, that could be one of the reasons. Um, if you're having frequent infections, you could be deficient. If you're having lung issues, you could have a deficiency in vitamin C. If you bruise easily, you could have a deficiency in vitamin C. If you bruise easily, there's a lot of other reasons. It could be iron as well. It could be amino acids, but this is one of the things. Um, if you have, a lot of gum bleeding or nose bleeding, that could be another reason why you're deficient in vitamin C. Any teeth issues, that could be another reason. Calcium is another big one. Um, Recommended dose really 500 to 600 milligrams a day. It's really obviously important for bone and teeth, for muscle contraction. A lot of people don't realize if you're getting cramping, there's multiple reasons that may be happening. CoQ10 is one of those things. It really works within the muscle, but calcium is another one. So there's something called neurotransmission. So we have neurons that speak to each other, and they send it's just miraculous to me how the body does this, but it sends little signals to different neurons, And calcium is one of those things that comes across the membrane. So you need that for muscle contraction. So if you're deficient in calcium, that's one reason why you may be having, you know, some cramping or poor muscle contraction. It's very important in blood clotting. It's very important in nerve transmission. Protects you against cancer as well and prevents high blood pressure. So if you're deficient, often they associate with osteoporosis. There's other reasons. Osteoporosis is also linked with inflammation, but muscle cramps, colon cancer could form because you're deficient in calcium. Obviously, your blood pressure, premenstrual symptoms, salt cravings. So this is an interesting one. If you're finding that you're craving a lot of salty things, chips, pretzels, things with salt, you could be deficient in calcium. Sometimes just resupplementing a little bit of calcium at 500 to 600 milligrams a day can cure that for you. Numbness and insomnia. Magnesium is a biggie, biggie, biggie. So it's a big mineral, really important, associated with a lot of different things. So about 400 milligrams a day. Again, if you can get it in a powder form that you can drink, or in a liquid form, that's obviously the best in all these cases. If you can get something in a powder or liquid, it would be superior.
And what about, I know some, like I see at Trader Joe's, so I think it's B12. Some of them are ones that you just put on your tongue and let them dissolve. How are those compared? Those are good.
That's fine too. Yeah. So long as your stomach acid isn't getting to it, because when your stomach acid gets to a pill, like I said, it degrades the quantity of what you're getting. And then on top of that, if you've been taking ibuprofen and you have leaky gut, then you're really getting a minimal amount. Because I've had some patients that said, I take B12 and it's not helping. Well, B12, we'll get into B12, but it has to be, number one, in the right format that the body can use, because we have something called MTHFR conversion. So the body has to, if you're missing the enzyme that converts the B12 into the format that the body can use, which a lot of people have that DNA malfunction, then you're not getting it. Your body can't convert it to the usable form. So I always recommend, if you're going to be getting B12, get it in the methylcobalamin form, not in cyanocobalamin. Cyanocobalamin there's a little bit of cyanide in it. That's very, very synthetic. So methylcobalamin form, that is the format that the body can use it. So it doesn't have to convert it. That's
and one thing I want to add to that, for using some other means of distribution versus ingesting. For those of you, some people are ingesting oils as supplements, and when you ingest an oil and it gets metabolized by the liver, there is a whole slew of other things to be mindful of. So the best way to put on an oil would be topically, like in a carrier cream or oil. The aromatherapist and me just wanted to throw that out there. And then you also don't have to worry about counterindications, like coumadin, for example, with grapefruit is not a good combination. So if you were taking grapefruit extract as a supplement, or grapefruit oil as a supplement, if you do it topically, it's not metabolized by the liver, whole different result. Right. So just throwing that out there too, for those of you who might be doing aromatherapy type supplements.
Yeah, and I don't know if you want to chime in about, I've heard various things with ingesting oils. What are your thoughts on that?
My thoughts are that if it has an FDA approved label for supplements, an additional process happened to the oil to heat it up and remove some of the volatile chemicals. So those companies advocate ingesting it, but in actuality, only a medical doctor who's also trained in aromatherapy should recommend ingesting an oil, because there's all kinds of different things for long-term toxicity, lethal dose rates, and things of that nature that you then have to worry about. So if you're going to do it, I don't recommend it. However, don't do it all the time. Like if you're doing it every single day, eventually that builds up and you might have some issues. Like there was a guy who was chewing Big Red gum like every day. He was like addicted to Big Red gum, and he had long-term toxicity poisoning from the cinnamon oil. So when it comes to oils and things, less is more. And topical, you get a way more measured dose, and it's not metabolized by the liver. There's far less things that you have to concern yourself with versus if you're internalizing it.
So more, because I've heard it all across the board, to just, put a couple of drops of peppermint oil in your tea, or, so I just wanted to get your feedback. Yeah, well, I'm not trained in aromatherapy. So
well, one drop of peppermint oil is equivalent to drinking 30 cups of tea. So if you're putting a couple of drops in your tea, that's a lot. and now it's also being metabolized by the liver and things. So, and I'm not trained as in medical stuff. I am trained as an aromatherapist, and my school of thought, when my teacher would say you don't ingest oils, there's very few circumstances, and then you would consult someone like you, because out of the 350 components in rose, how do you know what's counterindicated with what if someone's on medications?
Yeah, I think you have to be trained in
Yeah,
aromatherapy as well to be able
yeah.
to do
So maybe
that.
we
I'm
could work
not,
together on that.
so I
But
would,
there's
let's do an episode on that,
Well, I don't. We have to
just
really
in
do some
that.
research ahead of time for that. But there are certain things with like diverticulitis. There's some oils that are good for internal. I won't say it on air because I'm not a medical doctor, but there are certain things. And then if you're in Germany and you're a physician, one of the electives you have in medical school is aromatherapy, and they might prescribe you peppermint oil for something. So it's like a whole nother world in medical in other countries where
It's
the
amazing. Yeah.
holistic
And
world. I know I'm
I
preaching
should
to the
have
choir.
moved, right? I should have moved to Europe and just done, got my medical license there because I would have loved that. It is part of their national drug, national, what's the word I'm looking for? Help me out here. It's part of their repertoire
Right.
of drugs. So they don't necessarily use a medication as a first line of treatment. They do have homeopathics are part of their repertoire along with medications, which we don't have here. But it's I'm sure you've heard too, Hank. It's been on the ballot with the government to actually ban homeopathics here
Yeah, and even
in
aromatherapy. Like
America.
if aromatherapy ever got regulated, only the aromatherapists who, because I am a certified aromatherapist, but it's not regulated. So what does that really mean? But there's a group called the Aromatherapy Registration Council that if you become a registered aromatherapist, though it still doesn't mean anything, you have to pass an equivalent of a medical board to get that. And so those are the people that are still going to be in business as aromatherapists if something like that ever got regulated.
Well, you better get on it.
No, well,
I'm sure.
I was learning something about all that stuff you got to memorize and the body parts and
Yeah.
like botanical names. I'm like, I don't have the bandwidth to memorize all that stuff, but I know
Yes,
how
you
to use
do.
oils. I do,
That's
but
one thing I was great at is memorization. I can regurgitate,
oh, it's not fun for me. Well,
but
maybe things will change, but right now that's not calling to me like some other things. But
let's hope that that doesn't pass because that would be, I
it would be
mean,
sad.
I'm moving, if that happens. Anyway, we got off topic, but back to magnesium, 400 milligrams a day. If you can get it, I have certain companies that have it in a powder form that we can get that you can drink that has better bioavailability, better absorption. But it's so important in so many metabolic reactions. So that's a big category, metabolic reactions, but really, really important in so many. In muscle activity, in nerval function, so really important in temperature regulation, blood pressure, biggie in blood pressure, really important in detoxing too, and aids in just a lot of bone processes as well. So magnesium, you probably have all heard a lot about magnesium. It's a very important mineral. So what happens if you have a magnesium deficiency? Sugar cravings. So um, I think I have a magnesium deficiency because
Well, sugar cravings
no,
can
I
be a
just
sign
crave
of a lot
chocolate.
of different things, but
But so calcium, let's remember, is one of those things that if you have salt cravings, you might be deficient in calcium. If you have sugar cravings, you might be deficient in magnesium. If you have a lot of nausea and vomiting, you might be deficient in magnesium. Fatigue, cramps, numbness, tingling, seizures, really interesting with that one. Heart heart palpitations, personality changes. I'm sure you've all heard a lot about just magnesium deficiencies and feeling low, maybe a little depressed, and then you get an antidepressant when all you maybe have needed is just some curtailing of some B12s and some magnesium. Let's see what else. Hypertension, high blood pressure, coronary artery disease, asthma, constipation. If you're constipated, you may be deficient in magnesium as well, insomnia and depression. So magnesium's a biggie. It's a really important mineral. What else did I want to talk about? Copper is a really important one too. Its purpose is for energy. It helps in hair and skin. It's important for the immune system. It's important for iron transport.
that's the problem. Copper deficiency. I've always wondered. No, I'm kidding. Oh,
Could be,
could
could
be.
be. I think you can actually gray hair is interesting. It could be a copper deficiency, and it's also associated with fear. That's an interesting consistent fear. It's fascinating. And taste. So copper is one of the things that, alongside with zinc, that affects your taste. So what happens if you're deficient in copper? You could have anemia. So that's a big one for folks. Baldness, sorry. It's right here on my list. Diarrhea, generalized weakness, impaired respiratory function. So sometimes if you're having a difficult time breathing, this is one of the things. Like I said, there's a lot. It's not just, just take copper and you're able to breathe. There's a lot of different reasons why that happens, but that could be one. Decreased in hair and skin pigment. So if you're having, you're really white, that could be one of the reasons. And if you're getting gray hair, copper is one of those things. Decreased resistance to infection. So it's really important in the immune system. That is one of those things that I use right now with my immune boosting sessions, a copper, silver, gold mixture to help people if they're getting sick, especially during this COVID time. A deficiency can increase your LDL, which is a cholesterol. It can increase binge eating, which is very fascinating too. Um, and a deficiency in copper can decrease your whole low body temperature, so it's temperature regulation. So that's a lot. Copper's a biggie, and a lot of people I do find are low when I check on my device. There's a lot of folks are low on copper, but you do have to be you don't want too much copper. So copper and zinc kind of work together. We're going to get to that next. Selenium, really important for the thyroid. You take it as selenomethionine. Really important for people that are hypothyroid, have an issue, you can supplement that. Digestive enzymes. So that's a biggie too. If you're having difficulty digesting food, and as we get older, so after the age of, I believe, 60, we start to decrease our stomach acid. I could do a whole topic on that, on what happens if you have low stomach acid. You can develop um, skin issues, you can develop rheumatoid arthritis, you can develop so many different things. I have a whole list actually of things that you can develop if you are deficient in hydrochloric acid and basically all the enzymes and acids that digest your food. You have to digest your food. It's really important. So what are you looking for when you're looking for digestive enzymes? You want to find one that has amylase, protease, lipase, and a few others that are good. Bromelain, um, pancreatin, papain, pepsin, betaine, and HCl. So that's an amino. So if you look on the back of the bottle, you're going to want to look for those things, that it has those slew of things. Amylase, protease, lipase, plus some others would be beneficial, such as bromelain, pancreatin, papain, pepsin, betaine plus HCl. So digestive enzymes, again, help liquefy your food so that the stomach can absorb it and use it better, because you might be deficient somewhere and not being able to liquefy that food by yourself. CoQ10, really important as we discuss with statin medications. Those are your cholesterol medications. It also helps with energy. It's also fascinatingly great for decreasing blood pressure. So you probably want to take, I vary with people, it depends on what they have going on, anywhere. I'd probably say as a standard 200 milligrams, either in the morning, in the evening, 200 milligrams. Sometimes I up that to 300, depending if somebody has blood pressure issues. It helps in the mitochondria, so it helps with energy, and it's a great anti-inflammatory. So CoQ10 is another biggie that really helps the inside of the cell. So L-glutamine is another one you can use for sugar cravings, to calm your sugar cravings. It's usually in a powder. I recommend using it as a powder, getting a really good brand. And it also helps with alcohol. Alcoholics can actually use L-glutamine to help curb and curtail some of the desires for alcohol. And it also is great for metabolism, increases metabolic functions. Curcumin is a big one that people talk about, and that's your turmeric. So they extract, curcumin is the extraction from turmeric. Turmeric, I can never, what's the, turmeric?
I always say turmeric, but I don't really know what's correct.
I always got corrected. It's not turmeric, it's turmeric. Okay, whatever. It's a great anti-inflammatory. It does great with blood sugar regulation and metabolizing your carbohydrates. Let's see. I think those are biggies. DHEA is really important too. We get depleted in DHEA as we get older. It helps with hormones. It helps the liver, or I'm sorry, it can be tough on the liver if you're taking too much. So DHEA is something that I actually like to measure within people if we're dealing with a hormonal issue. before somebody's supplementing too much or too little of that. So we've done a lot in a nutshell. I have more, but
Yeah, we could definitely break it up too. And just to put up your website again, if you go to the website in the upper left, that's Dr. K's website with integrative health management. And there's an option on there if you are interested in seeing what she might be able to customize for you. You can schedule like just a time to talk to her on the phone, and it doesn't matter where you live. She can do almost everything
I can do
remotely.
virtual calls.
And even
Oh
if you
yeah,
need blood work or something, she can have lab people come
I
to your
can do that
house.
remotely.
So,
Yep.
yep.
There's lots we can do remotely. So I think the other thing we mentioned, we want to talk about what vitamins compete with each other and what vitamins work synergistically. So a
That
lot
and
of
another one that came to me that just thinking about the Romans actually is what thought made me think about it is what could happen if you have too much of something, like somebody that goes overboard on supplements. Maybe that could be a whole separate thing. But the reason I thought about it is one of the theories of the fall of the Roman Empire was like lead poisoning, because a lot of their recipes had a whole bunch of sodium in it. One of the side effects of lead poisoning is the inability to taste salt. So like what there might be symptoms too of things where you might have too much of something if you've gone overboard or eat certain foods a lot, like as a staple that can cause things like that. Maybe we'll save it for a whole separate conversation.
that
Over
is a whole separate conversation. Like carrots, for instance, if you eat, a lot of people like to, I don't know if a lot of people, but they like carrots as a snack. But I have had clients that said, well, I'm using carrots as a snack, and I'm eating a lot of them, but my eyeballs are starting to turn kind of yellow. What's going on? It's too much of the beta carotene in the carrot. It will pigment your skin. So that's just food. It goes both ways. Food and supplements too much can cause an issue.
everything in moderation, or
Everything in
learning to
moderation.
tune into the body and find out body what do you need, and you'll I find I naturally crave foods like randomly, and I just think it's my body's way of saying, hey, I need something from
You
there,
need
like
it.
my
Yeah.
pineapple and pistachio craving, which is one of my favorites. Like what made me want both of these
That's a
things.
pregnancy type of You okay, Hank?
No, no, none of that. Well, I would definitely make
None of that.
two's enough.
You're right.
uh,
The day they have men getting pregnant, I want to live for that day
Well, there's an
because
old
that's going to
Cosby Show
be
episode where they had a dream and all the men were pregnant and they gave birth to like hoagies and Pepsi bottles and stuff like that. It was a really fun episode. And speaking of fun, my cousin who is watching pinged me on Facebook. This is a picture of me way back in the day with hair. Look at that.
oh my gosh, it doesn't even look like you.
I know that's me though. That's me.
Wow.
I don't know where you got this picture, Anna, but wow, that was a little blast from the past. Thank you. My hair used to be even longer than that. It was so long you could braid it at one point in high school.
And now
Now
you
that's
got nothing to
it's
braid,
gone. Yeah, I
but you
should.
look good like that. It's okay.
I like it. It's easier to take care of
It's
than
low maintenance.
I
You don't
thought
have
about
to
growing
get
in a beard to like get along with Casey on there, but then I'm like, oh, look at all those gray hairs in there. I don't want that. I'll shave it off again.
oh my gosh.
But thank you for
That's
sending that
funny.
in, Anna. So going now to things that compete with each other. I know last week we were talking about like calcium and iron might be one of those, but there's other things that they don't necessarily mesh well together, and you want to make sure you separate them or don't take them at the same time.
Yeah, and that's challenging, I will tell you, because majority of the vitamin bottles that I see have all of them in there. But if you really want to break it down, some of them do compete, and there's so far I've only found one company. I'll admit I haven't done a ton of research, but I only have one company so far that breaks these up so that they don't come. So you take a packet, it's a powder form. It's just a little packet. You mix it with water. They have different flavors. You take a packet in the morning and a packet, whatever, in the afternoon or evening, so that these guys don't compete with each other. I've so far only found one company. All the other kind of companies that I use, I look on the back and they have all of these. All of these are in there together. So
Right. And then it's hard because
um,
then you almost have to take everything separately so you can control what you're taking when.
it is a bit challenging. So you could really go nuts with it all, but we do the best we can. So if you really want to get nitty gritty with, I do have a good company that has a good format, but all in all, I mean, just get your vitamins from food. I mean, so B9, which is folate plus zinc, can't be taken together. But odd B12, or I'm sorry, B2 and zinc work synergistically. So I'll go into how we can kind of counteract that. B5 and copper can't be taken together. Vitamin A and vitamin D can't be taken together. They compete with each other. Zinc and copper compete with each other. B5 and B7, which is biotin, compete with each other. And let's see, iron also will compete. So iron has to be taken apart from everything. It will compete with a lot of different
It
things.
doesn't get along with things.
It
It's
doesn't.
funny.
So how do we, I mean, there, like I said, I do use a company that um, kind of separates all these things, but how else can you get around it? So backing up to the B vitamins actually all work together. So it is kind of important to take a B complex, and I do have a company that has a powdered B complex that's great. So what you do is you take your regular vitamin. There's multiple companies that I use that are good, that have a powdered form or a liquid form. But take your regular vitamin, and then you'll have to separate, and you'll have to take your vitamin D, like get a separate container of vitamin D, um, and get a separate container of iron if you're taking iron, and a separate container of a separate bottle of zinc. I like zinc sulfate and get it in a tincture form. So those couple of things that are important, especially right now, zinc is super important with the COVID. How much should you take?
Well, and how
Um,
much should you take kind of leads into a question too. Like finish that thought, but Anna was asking at what age do you consider the supplement dosing for adults? She has two children, 12 and 14 years old. When do you jump from a dose for a kid to an adult? I have some thoughts from
12.
the aromatherapy perspective, but
12 to 13, they can take adult dosing. Yeah. I have a company that's great for kids. If you have kids that are, 12 and under, I do have a company that I use that has a great multivitamin for kids that's in powder form and tastes good. I'm going to detour on that and say, a lot of parents feed their kids the whatever Costco gummy brands, whatever those things are, or gummies. Those aren't great products. I will tell you that right now. They're they're not great. So if
don't
you
tell my
want,
wife that. She loves those things for the kids.
I can give you a connection to the company that I use that has a really great powdered form, and it tastes good and kids really like it. So that might
But
be a
definitely, I would
suggestion.
like to do that.
But a lot of the Costco brands, your kids kind of really aren't getting what they need. But if you can encourage kids and start them early on good foods, that's just really key. Like your son likes a lot of stuff
Yeah.
already that
Oh,
most kids
he
don't.
reads. He would rather have cut up raw vegetables
Awesome.
than something cooked. Like it's like so. I think that's great, but sometimes it's frustrating for my wife because she'll go out of her way to make something that everybody can eat, that I can eat, that Oliver can eat, and then Max is like, "Nope, this can be a red pepper cut up."
No,
So
that's great, but a lot of kids are not so great with that. But really, yeah, if you need a reference, please just email me or send me a message or below, and I can get you the company that I use that has a good formula for kids that's
and
powdered
I'll ask for that,
and
and I'll
liquid.
pass it on to Anna. Anna's my cousin actually, who was asking the question, and
Oh,
send in a
okay.
cool, awesome picture of me with hair.
That we'll never see again.
No, well, we'll probably see it again. Now that I have it, it's kind of a fun picture to put up every once in a while.
So yeah, so you want to get like your separate bottle of zinc, your separate bottle of D, and then just take your regular vitamin because it's most companies don't separate those. It would kind of be a lot. Plus, they don't have the amount of vitamin D usually that you need in the regular composition of the multivitamin. So you need way high. I don't know how much they put in, like maybe 300 IU's or 500 IU's of vitamin D. You need way more than that, which gets me into the separate topic of vitamin D, which is really, really important right now. It's it acts as a neurotransmitter, it acts as a steroid, it acts as a mitigator in a lot of nutrient issues. I mean, vitamin D has so many large purposes that you really need it in your system like 24/7. This is one of these things. So, four things everybody should be on basics, just baseline, and that's a probiotic, minerals, a good multivitamin, and vitamin D. Really, really important. Like, I can't stress that enough. So, you want that in your system right now because it has a huge role in the immune system. So, right now, I tell people during this time, keep it at least 5 to 7 IU's. If you're ill, bump it up. You can do 3 days of like 20,000 IU's, but only for 3 days. Vitamin D is one of those. vitamins that you don't want to overdose on because the body can't excrete it. It is also fat soluble, so it is best taken with some sort of fat source, like an avocado, a nut, a little bit of cashew butter, almond butter. It's better absorbed when it's better absorbed into the cell that has a lipid layer. So it kind of gets into the cell better and used more efficiently when it's taken with a fat source. So vitamin D is super, super important. So take that separately. Um, from your multivitamin, take your zinc separately and vitamin B separately. So I use a B complex in a powdered form, and it has all the B vitamins as well as, I believe, methylfolate in it. Folate, another one. You just don't want to take folic acid. If you're lacking the enzyme that converts folic acid into methylfolate, which a lot of people lack that enzyme, you're not getting it. You have to get it in the methylfolate form.
And we actually have a question too. What's the difference between zinc? I'm going to mispronounce these words, I'm sure. Pacolata? I can't say it. You could read it there.
Picolinate. I have to I'm going to have to get back with you on that one because I'm not really familiar with the orotate form. Um, so I want to make sure I'm getting you the correct information. So if we can make a note on that, Hank, I will
Yep,
get
I
back
will.
to you
I'm
on
not
that.
sure which stream he's looking at it at, but we will make sure we comment back and get the answer
Otto,
for
we'll
that
get
after
you
the
that
stream.
answer. Let me just research that a little bit more because I'm not super familiar with the second form. I usually just use the zinc sulfate. There's in another format too, but the zinc sulfate right now is the most important one with the COVID. So I want to make sure I research those and not give you some incorrect answer on that one. But yeah, so take those separately. And then with vitamin D, you actually want to take vitamin D with K2. Why? Because there's a lot of calcium that floats in the system, and the K2 will propagate the calcium where it needs to go, so it doesn't float around and create calcification. So it helps move the calcium where it needs to go. So it is suggested to take vitamin D with K2. So when you're looking on the back of the bottle, make sure it says K2 on it as well. And you want to take, like I said, about 5 to 7,000 IUs. If you're sick, bump it up to 10,000 IUs for a week. Like if you're dealing with the flu or maybe you have COVID, you can do 3 days of 20,000 IUs, or if you're really sick, but only 3 days, you don't want to stay on that dose. And I don't think you really want to stay on a dose of 10,000 IUs. Again, everybody's body and DNA is different. So some people handle 10,000 IUs fine, but the really suggested dose through my functional medicine, folks, and the going rate really is 5,000 to like 7,000, 8,000 IUs daily. So hopefully that's helpful.
Very.
And then vitamin C, that's another big one. Those are the big three right now with the COVID going on. Vitamin D, zinc. Oh, I didn't give you the dose on that. Some people are saying 100, some people are saying 50. I would say it can upset the stomach a little bit. So you have to get a gentle form, but I'd say anywhere from 20 to 50 milligrams in droplet form. Zinc sulfate's great in a tincture you just put underneath your tongue. But make sure you're taking that separate from the bees and separate from your iron. And iron, that's another one you're just going to have to
Can't
take
they all just
separately.
get along? I mean, come on. No, but
We
it is
try.
very important to be mindful of taking them all together. And I know before we were started the stream, we were talking before we came on that it's not just what you're taking; it's also about where you're getting them from, because there have been some sellers on different websites that may have bought expired product, or they might have altered it, or claiming something is one thing and it's not. So can you speak a little bit about doing your due diligence and as to where you're getting your supplements from?
Yep, absolutely. So I have a lot of patients that just love to go on Amazon, and I found this cheaper on Amazon. You take Amazon with a grain of salt. I work with a lot of companies that are policing. They actually have virtual, internet police that go on and shut these people down, because a lot of the companies that I use, and some of the products that I use, are by professional use only. And for example, I was telling Hank, I have homeopathics that I use that's a whole other topic on homeopathy and what things you can use to detox yourself. I have very specific tinctures that I use for detox. But I went on Amazon and I found them on there, and I called my people and I'm like, do you realize your stuff is on Amazon? They're like, no. I'm like, yeah, you got to get that off because somebody's going to take something and then they're going to get sick or it's not going to work and they're going to post, something saying, reviewing it and that it's bad. When it's not, you didn't have the proper direction with it. That's one thing. So there's a lot of companies out there that are going after people that are selling their products on Amazon because they're supposed to be professional use only, meaning you have to have a consultant that kind of knows about the product. Number two, the other thing I've come across is, and that I've heard, is that you can get supplements, but they're expired, or people have tampered with the label and put the wrong product in there. You enter at your own risk. I use certain physician dispensary companies that have, really great products that are FDA certified, that are, they're just good companies, and you're getting what you're getting. So I always caution people to, hey, I can still get you a discount through the physician dispensary if it's an issue. We can match that price on Amazon. Sometimes maybe even get it, cheaper, depends, but we can match that. And you're better off knowing what you're getting than not knowing what you're getting. I'm not saying it's always the case with Amazon, but that's what I've been warned by especially with the homeopathics. I was like, wow, I mean, I had to go through a course to learn about these. So for somebody to just go online and get it, I was like, I don't know that that's what's supposed to be done.
And I put your website back up if you're interested in connecting with Dr. K for just getting supplements. That's the website, and you'll find her. There's a contact form. You can schedule a phone consultation, and you could also just, I believe, email or call her and connect and talk about what things you might need. But I highly recommend check out that biofeedback and really, like, just one session at least can give you the information to kind of dive in and get a little bit more detailed information than what you can do just in a conversation, because that machine is
Absolutely.
amazing. I can't speak about it enough. It was just mind blowing when I was on it and saw all
We
the
didn't even
stuff.
scratch the surface. You need to
I
come in
know,
for
yeah.
a full
That's
one.
it was just like a little teaser session, and then I could even feel my body like responding to it. And then right afterwards, we were doing an episode of Stir Crazy Shamans, and behind me the lights were just going crazy behind me, and I was like, "Yeah, Dr. K's at me," and then the cameras was just picking up light frequency distortions or weird things, and it's always the same camera, same background. Nothing changes except me, I suppose. And Dr. K zapping me with her machine.
Zapped you. Yeah, I think, are there any questions? Because there's a lot. So with COVID, those are the three: vitamin D, zinc, and vitamin C. Oh, how much of vitamin C? That's another one. You can get constipated if you take too much vitamin C. You can cause stomach upset if you take too much vitamin C. Anywhere from 1,000 to 2,000 right now. I mean, the recommendation is 2,000, but if that's causing constipation, back down to 1,000 milligrams a day. Yeah. And if you can get a liposomal, liposomal means it goes under the tongue. So it's kind of like they usually have it in a kind of a squirt formula that it goes, under your tongue. So it has a different absorption than going through your whole system.
Cool. Yeah, ask your questions and you can vote. We have like 3 topics for that we can go down for next week. We have leaky gut on the table that we could talk about. That kind of goes hand in hand with candida. Antidepressants we could talk about. Homeopathy we could talk about, or any other topics if you want to just comment on what you might want to hear about. But if you have any questions about supplements, now is the time. We'll give a minute here because I know there's a little bit of a delay from commenting on YouTube and Facebook. So if you're making a comment, it might be a moment before we can see it. And if you comment after the stream, we will take the look at those as well and make sure Dr. K especially I've noticed is really good if you've made a comment after the stream is over. She's really good about responding and interacting with you afterwards. So definitely continue to ask your questions if you're watching this on a replay. And if you're watching on a replay, start a watch party and help us spread the information.
Yeah,
And
party. That's fun. That's the new thing, a watch party.
yeah,
And
you
if
have
I
to do watch
happen to
party.
not respond, please tag my name because
Yes.
Facebook's getting a little weird. I go back and I can't find somebody's comment, yet I know it came through on my phone. And then I'm going back looking for it and it says only showing the most relevant, or some have been filtered. So if I happen not to get your comment, I'm not ignoring you. Please just tag me again, ask again, and then I'll make sure that I get in there immediately and find that. I don't want anybody to feel that I'm ignoring them, or,
Yeah. Or go to her Facebook page. You can send her a message on her Facebook page would be another option,
yeah,
or through her website.
or
But
email me. It's all on there. If I happen to not respond, please email, and I'm happy to, respond that way as well, because all sorts of funky things going on Facebook.
And
Things getting taken down
And I
and
know the majority of the people today, we had a few YouTube watchers, but most of the people are on Facebook. In the description, I did put a link to the YouTube video. And if you can go there and make sure you like and subscribe it, that is the one place that we will always be streaming no matter what. The other locations might vary. So if you want to make sure you get notifications when we go online, YouTube is definitely a great way to do that. And then also, the more subscribers we have, the more thumbs up we have, the more comments we have there, YouTube will serve the video up organically out to other people. So that is also another great, you can help us spread this information out there. If you just take a moment to like, comment, subscribe, that always helps us out. But it doesn't look like we have any questions today. You're getting off easy.
well, this is I mean, there's so much. I mean, for somebody to really, it's challenging sometimes because somebody just wants to know what can they take for themselves, and that we have to do a little bit of an evaluation because I obviously don't want to give anybody something that my oath is not to do any harm. So I abide by that as best as I can. Had a funny comment. I just thought of a funny comment somebody posted yesterday that Amy Acton should be whatever, she's getting death threats because she took we do take a Hippocratic oath not to do any harm, but that's kind of going by the wayside a little bit. I think it's getting interesting these days. But yeah, I definitely want to know a little bit more. So sometimes people want to know, well, should I take this for this? Well, it depends because a lot of people, this is the last comment that I'll make is don't go to GNC and get supplements, please. Some of that stuff at GNC is not good. And a lot of people just pull things off the shelf. And yes, like I heard curcumin is good and I heard this is good. And so that's why I'm taking it. Um, it's okay. It might not be benefiting you. It might not be what your body needs specifically. So better to get down and dirty and figuring out what your body needs specifically versus just, taking Saccharomyces boulardii and well, I heard that was good, and I heard cranberry juice is good, and I heard this is good. So people are taking all these supplements. The other thing I will mention, I don't like to keep people on supplements aside from the vitamin D, the probiotic, the minerals, and a good vitamin. Aside from those four, I don't like to keep people on a supplement for an extended period of time. That's not the goal. The body will assimilate it and it will become it. And then it's almost like a shampoo that just kind of doesn't work as well as when you first got it. So the goal is not really to keep you on things for an extended period of time. Even with probiotics, I switch people because you have a certain amount of bacteria that's being put in your stomach for a period of time, and you need a shift. Your body has gotten very used to that. So I usually shift people probiotics every 2 to 3, 4 months, switch to a different one, and
And
we
in
go
the
back
last
and
episode,
forth.
I talked about I was advocating for a probiotic for someone that I was at the hospital with, and the doctor just shut me down right away, citing some study. And when I went up and looked up the study, the people that were on the supplement were on the exact same supplement for a year, and then the people that weren't on the supplement performed better with a probiotic, however they test the gut or whatnot. But that's not how you would normally use a probiotic, because you go on a month, you go off a month, you change it up what you're using, and it just really wasn't a great study because of the way that
Yeah.
it was structured.
And if you have trouble taking a probiotic and maybe it's causing some gas or whatever, there is one that you can put in your behind so it gets absorbed right away. So there's ways around that too. Sometimes we just start with that. So we can get that bacteria in there like right away if you're having, stomach issues. So there's lots of ways around that. I had another thought and I can't remember what that was now.
Poof,
Oops.
it's gone.
Poof, yeah. But I did mention that you just don't want to. I have people that come in with a box full of supplements they've been taking for years, and I'm like, you don't need all of these, and let's get rid of some of them because your body has already assimilated them. And the other really cool thing about my device is I can actually put the supplement on a tray that I have that's attached to the device, and we can find out how your body resonates with it. So does your body like it? Is it good? Is it not? That's a really cool feature I forgot on the biofeedback device.
Yeah. And resonance, just as a sound healer, one thing I'll notice is that when I'm using certain bowls or certain frequencies for the organs or whatnot, some people, like the forks aren't resonant at all, and I know that they're out of balance with that. And then by the end of the session, the fork, when you bring it the exact same way, now goes, instead of 10 seconds, it might go for a minute or 90 seconds. And that's the body coming into resonance. So the machine is able to, it's just like how, if the frequency's there, there's an interaction back and forth to the machine. That's why they call it biofeedback, probably, right?
It's all about frequency.
Yeah.
Yep.
So it's like shooting the frequency, and it's seeing what result, what pushback, or what frequency it gets back from the body, and how easily it goes through or bounces back, and that all tells you information about what the body may or may not need.
Right.
Pretty cool stuff.
Yeah, it's amazing stuff. So
I love it.
There's much more we can talk about. I hope this was helpful in a nutshell, and you can go back and write some of these things down. If you're on medications that I listed earlier, you may want to supplement, but really, again, the goal would be to curtail some of those things, and working with your physician and I to maybe see if you really need those, if we can get to the root of your high blood pressure, and there's so much we can do to do that. To lower it, so maybe you don't have to be on a high blood pressure medication, or you don't have to be on your diabetic medication. You know, it's that's always my goal, is to limit as much synthetic, because there's a reason they call medication synthetic, SIN. Kinda. The body doesn't recognize these things. It doesn't know what to do with it.
And that's one reason that you'll see, like, the doses on vitamins, it's like 4,000% of your recommended dose, because they know that the body, most of that's just going to pass through and it's not going to get in. And so they have to overdo it in order for you to get the minimal amount that it's going to get.
Right.
Yep.
So I don't know, is there anything else you want to toss in?
No, I think that's it. We've, we always think, oh, we don't know how much we're going to have for today, and then we're at an hour and 10 minutes. So
I know, I was like, I don't know how fast I'll get through this, but
thank you for
a lot of info.
Information. And for those of you who have been with us for the whole thing, thank you for joining us. Please don't forget to subscribe. And if you're catching it halfway through and you're going to go back and watch the replay, please share the video, start a watch party, or whatever feels like to you to help kind of spread the word.
Awesome.
And we have Otto saying thanks. You're very welcome, guys.
And I'll get back to you, Otto, on that, your details there. So
absolutely. Have a good one, everyone. Enjoy your big, long holiday weekend.
Yes. Till next time.